Imagine this. You take one capsule at bedtime, and 12 weeks later, your hot flashes and night sweats are down by about 70%. For many women, that's not a headline. It's a door opening back to normal sleep, clearer mornings, and calmer days. The capsule has a name: Lynkuet. It is a new, non-hormonal treatment designed specifically for the most disruptive symptoms of menopause, the heat surges that break your focus by day and shatter your rest at night. Unlike hormone therapy, Lynkuet doesn't replace estrogen. It works on the brain's thermostat, on the signals that became jumpy when estrogen levels fell. That's why the promise is not more hormones, but a steadier thermostat. To understand why this matters, picture the control room in your brain that helps keep body temperature in a comfortable zone. During the transition to menopause, that zone narrows. Tiny changes feel like big heat, and your body hits the cool me down button too easily. Blood vessels open, your skin flushes, sweat starts, and the night that should have restored you becomes another battle with the sheets. This isn't a failure of will. It's physiology, an oversensitive thermostat calling for emergency cooling when none is needed. Lynkuet's approach is simple to say and clever in practice. This thermostat network is made up of neurons that talk using chemical messengers called neurokinins. They listen through two key receptors, NK1 and NK3. Lynkuet, whose active ingredient is elinzanetant, is the first dual blocker that targets both NK1 and NK3 together. By turning down both listening posts at once, the alarm quiets, the comfort zone widens, and the surges ease. Because the same pathways touch sleep control, many people also report deeper sleep as the flashes calm down. It's one capsule, 60 milligrams, taken once daily at bedtime, with or without food. What does the evidence show? In two pivotal randomized trials named OASIS 1 and OASIS 2, women with moderate to severe symptoms saw statistically significant improvements by week 4 and further gains by week 12 compared to placebo. Severity dropped, frequency dropped, sleep improved, and menopause-related quality of life moved in the right direction. These weren't just questionnaire blips. They were the kinds of changes people notice when they wake up less, sweat through fewer shirts, and feel more like themselves. Importantly, benefit didn't fade after the first months. A 52-week study followed participants for a full year and found that symptom control was sustained and the safety profile remained favorable. This matters because vasomotor symptoms often outlast our patients. A solution that only helps for a few weeks is not enough. The follow-through is the point. There is also evidence in one of the toughest groups to treat: people whose hot flashes are triggered by endocrine therapy for hormone receptor positive breast cancer, a setting where hormones are off the table. In a large trial reported in the New England Journal of Medicine, elinzanetant led to a significantly lower daily frequency of moderate to severe symptoms versus placebo, improved sleep measures, and more than 70% of participants achieved at least a 50% reduction by week 12. For many living through cancer care, livable nights is not a luxury. It is the difference between coping and being overwhelmed. When you zoom out across the clinical program and public reporting, a simple pattern appears. By week 12, reductions in hot flashes and night sweats often cluster around 70%, and in those who continue and do well, benefit can persist up to 1 year. That number isn't a guarantee for any single person, but it is a useful expectation setter for what success can look like. Starting Lynkuet looks like this. Your clinician confirms the indication: moderate to severe hot flashes and night sweats tied to menopause, reviews your medical history, checks your other medicines and supplements, and usually orders baseline liver blood tests with a follow-up after the start. That monitoring step is a cautious standard shaped by experience with this class of medicines. You pick a routine, bedtime is typical, and plan a check-in around the first few months to look at sleep, frequency, intensity, and overall quality of life. There are a few practical rules that make a real difference. Avoid grapefruit or grapefruit juice. It can raise Lynkuet levels through liver enzyme interactions and increase side effects. Share a full medication list with your clinician, because drugs that strongly inhibit or induce CYP3A can push levels up or down in ways that matter. The U.S. prescribing information specifically advises avoiding strong inducers and strong inhibitors, adjusting with moderate inhibitors, and steering clear of grapefruit products. If you live with end-stage kidney disease, the U.S. label says Lynkuet is not recommended. These are the quiet details that keep you safe and help the medicine do its best work. What side effects should you expect? In studies up to a year, Lynkuet's safety profile has been favorable, with common side effects like sleepiness, lightheadedness, headache, or fatigue, often mild to moderate and commonly easing with time. Labels in different countries can vary in wording, but the theme is consistent. Start thoughtfully, monitor early, and keep communicating. If you feel unusually drowsy in the first days, be cautious with driving until you know how you respond. Regulatory milestones underscore that this is now a real-world option, not a lab idea. In July 2025, the UK MHRA became the first regulator to approve elinzanetant under the brand Lynkuet for the treatment of moderate to severe vasomotor symptoms due to menopause. In October 2025, the US FDA approved Lynkuet 60 milligrams soft gel capsules taken once daily at bedtime, with clear guidance on interactions and dosing. Other countries have followed or are reviewing, and European materials describe the 60 milligram soft capsule and the dual NK1 and NK3 mechanism aimed at normalizing the hypothalamic circuits that govern temperature and, indirectly, sleep. These steps reflect both the unmet need and the strength of the trial data. Now bring it down to the human timeline. In the first 2 weeks, many people are simply getting used to the routine. Some notice that they wake fewer times or sleep a little deeper. By week 4, the pivotal trials already showed significant improvements in the severity of hot flashes compared to placebo. In everyday language, that can mean fewer midday surges and a little less dread of the night. By week 12, the average reduction often approaches around 70%, and that is where many say the difference is unmistakable. Fewer interruptions, calmer nights, and mornings that feel like mornings again. For those who continue to do well, benefit holds in the long-term data. Because choice is central in midlife health, it helps to be clear about what Lynkuet is and what it isn't. It is a non-hormonal, once-daily capsule built for hot flashes and night sweats that works by turning down NK1 and NK3 signaling in the brain's thermostat. It is not a message that hormone therapy is bad. Many do very well on hormones, and for the right person at the right time, they remain highly effective. Lynkuet sits alongside those options as a targeted alternative for people who prefer to avoid hormones or cannot use them because of medical history, including those on breast cancer endocrine therapy. The goal across all approaches is the same: better nights, steadier days, more you. If you are thinking about trying Lynkuet, a short checklist can make your appointment more productive. First, describe your daytime frequency and your nighttime wake-ups, because sleep is often the real measure that changes lives. Second, bring your full medication and supplement list, including over-the-counter products and herbal blends. Third, ask about the monitoring plan, what baseline tests are useful, and when to follow up after starting. Fourth, set a realistic timeline for assessing benefit. Expect something by week 4, look for the bigger picture by week 12, and plan a decision point with your clinician. Fifth, ask how to handle travel, schedule shifts, or missed doses, so the routine survives real life. For many, the most convincing evidence is not a p-value, but a day returned. Think of the person who used to keep a towel on the nightstand and a cardigan by the chair because the post-flash chill could bite. 3 months into a once-daily routine, she is sleeping longer stretches, noticing fewer daytime jolts, and finding that her attention in meetings stays on the topic rather than on the rising wave. She is not a different person. She is herself with a calmer thermostat. The science explains the why. The lived day proves the so what. Before we close, a few details that often come up. Cost and access vary by country and insurance, and manufacturers sometimes offer savings programs. Ask your clinician or pharmacist what applies to you locally. If you previously tried a non-hormonal option like elinzanetant and had issues or limited benefit, it's still reasonable to discuss Lynkuet because the mechanisms differ. One blocks NK3 only, while Lynkuet blocks NK1 and NK3 together. Formal head-to-head comparisons are limited, so the decision remains personal, guided by your history, your preferences, and how you respond in the first months. Here is the bottom line in one breath. Lynkuet, elinzanetant, is a non-hormonal, once-daily 60 mg soft gel capsule that blocks NK1 and NK3 receptors to calm the brain's thermostat. In randomized trials, it reduced hot flash severity by week 4, delivered about a 70% reduction by week 12 on average reporting, improved sleep and quality of life, and sustained benefits through 52 weeks. Labels advise avoiding grapefruit, watching for CYP3A interactions, and starting with early liver blood tests per local guidance. It is approved in multiple regions, including the UK and the US, and offers a targeted alternative for those who prefer to avoid or cannot use hormones. That is the science clear enough for decisions, flexible enough for individual stories. If this helped you feel a little more in control, we'd love to stay connected. Like this video and subscribe to the Midlife Balance Institute. Tap the bell so you won't miss practical guides on sleep, hot flashes, and midlife health. Tell us in the comments what you want us to cover next, and share this with a friend who deserves a calmer night. Together, we make midlife feel lighter.